now let's get right over to the phones because, if you've been paying attention, pandemic's still going on.
Yes, it has.
And with that, we have brought in our expert throughout the entire pandemic, and that is our good friend, Dr. Dennis Norm from Mercy Health. Dr. Norm, good morning to you.
Good morning to you guys.
How's everything going this morning?
Oh, it's going well. That blue sky is quite a sight to see.
Isn't it, though? And, and reaching for a sweatshirt at this time of year and in the morning is an unusual step for us, but one we don't mind.
Absolutely. I don't mind wearing a sweatshirt in the beginning of August.
All right. Well, there's, I heard you and Joe off the air. There's lots to talk about this morning. What's number one on your radar this morning as we talk pandemic?
It's the Delta variant. It's the resurgence. It's, I would say, frustration might be another word. We have not gotten enough people vaccinated, so this resurgence of coronavirus was totally predictable. And this Delta variant is running quite aggressive across the country. Again, not surprising. We just don't have enough people vaccinated.
We know we know locally. I mean, Missouri's been in the news as one of the hottest of all hotspots for Delta variant. Started to spill into Illinois over the St. Louis border there last week. Have we started seeing it up north here? How in danger is Illinois right now?
Well, I think it is the predominant, obviously, a variant that's affecting people. Unfortunately, it's so contagious that it is affecting us vaccinated people also. I see that several of the outbreaks across the country, the vast number of people getting ill are actually vaccinated people, not the unvaccinated. Now, the good news is, again, that people that are vaccinated are probably going to have very minor illness, very few deaths in vaccinated patients. But the bad news is it's becoming, much, much higher in terms of our percent of people who are affected. I see our rates locally have risen up to about a 6% positivity rate, and I think we were down close to 1% here in Winnebago County a few weeks ago.
I'm looking at a story from the Associated Press this morning. They lead off by saying, in another dispiriting setback for the efforts to stamp out the coronavirus, scientists who studied a big COVID-19 outbreak in Massachusetts concluded that vaccinated people who got so-called breakthrough infections carried about the same amount of the coronavirus as those who did not get the shots. Health officials on Friday released details of the research, which was the key in this week's decision by the CDC to recommend that vaccinated people return to wearing masks indoors in parts of the U.S. where the Delta variant is fueling infection surges.
Yes, that is somewhat discouraging in that the fact that we're vaccinated, we thought, that was going to decrease the ability for us to transmit the virus. We're still not quite sure about transmission. In other words, just because the amount of viral load in a vaccinated person may be as high as an unvaccinated person, does that mean the vaccinated person is able to spread it as easily as the unvaccinated? That isn't quite clear yet. There's some data to suggest that no, vaccinated people may have as high a viral load in their body, but still not able to transmit it as easily. However, the concern is obvious that we probably can transmit it if we're vaccinated. And if that's the case, indoor, highly concentrated areas where lots of people are around, we probably need to mask up again. And none of us really want to do that.
And obviously none of us want to mask up again. The story's still the same as we've been hearing about with Delta variant and even those vaccinating, contracting COVID. Still much less severe symptoms. We're still at 99% of hospitalized cases of COVID being in unvaccinated patients.
Yes, it's still a very small percentage of vaccinated people are hospitalized. It may have crept up a little bit. I've seen numbers like 98% or 97% are the unvaccinated, 2 to 3% may be vaccinated, but again, very small numbers. We're seeing a few more kids who, obviously, the kids are not as likely to be vaccinated, so that's not surprising. The only good news in all of this is what's happening in England, in the UK. the speculation was that their numbers are going to continue to rise rapidly, and they've seen in the last week or two a pretty significant drop in their cases. So maybe we will see this in the next few weeks. We just don't know. But certainly there are differences between us and the UK. They're a little more vaccinated than we are, and they've been on some holidays, so the people in terms of concentration hasn't been as great. But that does hold some promise that maybe this Delta variant will burn itself out a little more quickly than we're seeing.
Speaking of the Delta variant, that is something that we're hearing those two words in conjunction all over the place. Now, let's say I come in, I'm symptomatic. You guys give me a test. Does the test come back and go Delta variant, or does it come back and say just COVID?
It comes back and says COVID. The state and FDA, or excuse me, the Center for Diseases Control have a system to identify the type of virus, but that has to be done through specialized laboratory testing. University labs can do it, but in your local community here, we just get back it's positive for COVID or it's negative for COVID.
So when we hear that Delta variant is running wild through X, Y, Z county, where does that number come from? Does that come from a couple weeks later when these tests go through further screening, or is it just COVID that we found in non-infected patients? How are we identifying it as a Delta breakout or a Gamma breakout?
Well, I think what happens is, again, the specimens are sent to labs for special testing to identify the variant. And they send a certain number, and it's an estimation. So they'll send a certain number and see what the ratios are between the variants. And they'll use that as an estimate to say, okay, that percent is what is the Delta variant versus the Alpha or whatever other variant they come up with.
Gotcha.
So in some cases where you're seeing people go, the Delta variant's doing this and that and something else, they may not know that for certain.
Correct. They may not know that. It's based on some statistical analysis of what's being tested.
Okay. Because, like I said, I've heard that, and like Joe said, of Gamma and these other variants, and I didn't know if the test had been refined to the point now that, it showed up purple on there. That means it's a Delta variant.
One would hope down the road we would have the ability to do that, but I suspect that's probably not going to happen because the testing is much more sophisticated than what we could do in a quick turnaround lab test.
You're a medical doctor, and you're very adamant that people do need to get vaccinated. We always tell people, if you have questions about your vaccinated status, please talk to your primary care physician about it. They have questions, so let's do that for a second. One of the situations or scenarios that I hear is, anybody that wants a vaccine right now can probably get it, right? If I choose not to get the vaccine right now, I'm taking that under my own, own risk and my own guidance. What does it matter to me if to the vaccinated crowd, if I'm unvaccinated and I get sick? Why does the medical community, other than wanting to save as many lives as they can, what do you tell that person why they should get vaccinated if they are willing to take the risk of COVID on their own?
Well, again, I would emphasize that it's not just a risk to the individual. It's a risk to society. And we've just talked about the fact that vaccinated people can still get ill and in rare occasions can still die from COVID. The more people we get vaccinated as a community, the less likely the COVID can spread, the less likely we'll see new variants, and the more likely that we'll get on the other side of this thing. So I would ask people, it's not just about you. And the other side of it is the medical workers in the medical community. You can see there are areas of the country that are getting overwhelmed again with sick COVID patients. And when that happens, again, it's not just a risk to that individual, it's a risk to the healthcare workers, and it's a risk to people with other illnesses. I think I saw in a hospital, and I believe it was in Missouri, somebody showed up in the ER and they told them it would be 2 days before they could see him. and this was somebody who showed up for a non-COVID illness. So that means, again, that we're going to have people becoming sick and dying from non-COVID disease because there's no room at the inn. So I'd ask people to think about more than just themselves. It's not just about yourself.
What are your thoughts on events like we just completed over the weekend, Lollapalooza in Chicago? Maybe you saw some of the overhead shots of the sea of humanity that was there for Lollapalooza.
Well, that looked like a perfect place to spread COVID. Again, people are outside, and that is helpful, but people were just packed in, thousands of people. So I will be interested to see what happens in the next couple of weeks in that area of the city, if we'll see a bit of a super spreader type situation. It sure looks like it could be.
I know this is going to seem like a political question, but it's not. I don't mean it to be one, because you can take any leader from any party and attach them to this. But, let's look at Lollapalooza over the weekend. We see the mayor of Chicago there, unmasked and part of the throng. We have the mayor of Washington, D.C., before putting a mask mandate into effect in like 2 hours, was out maskless at a giant gathering of people. That sort of messaging to the public, when you contrast it with what you, a medical doctor, are saying, starts to get a little confusing and annoying to the public. Would you agree?
I would agree. I think knowing that she was going to put forth a masking mandate, which Chicago has done, or I guess they call it a
guideline.
Yeah, that she should have, been out in front and said, look, I'm wearing a mask today because we're going to need to go that direction. That would have sent a much better message. Now, I understand her argument was, 98% of the people there at Lollapalooza had to show a negative COVID test or show vaccination. But we know the vaccinated people are spreading COVID, so could have been a much better example by masking up ahead of time.
You mentioned the CDC mask guideline mandate, however you want to say it. They said, counties, what's the term? Surging. You have surging
substantial.
Substantial, that's what it is.
Substantial. Yeah, there's light, substantial, and heavy or something like that.
Yep. And if transmission in your county is substantial, that the mask guidelines would be in place. Boone and Winnebago County both fell under substantial. Not just you as doctors, just you personally, Dr. Norum. You're vaccinated, you're out there in public, or is it time to throw the masks on when we're going back into the grocery store already? Is that something that you're abiding by personally?
I haven't quite decided what to do yet. Obviously, I'm back working part-time, and we're obviously masking up in our facilities and being checked every morning. We get our temperatures still taken and that kind of thing. And, yeah, I think my wife and I have talked about it. She's back in Tucson. She's starting to mask up again at the grocery store, and I suspect I will be too.
Okay. Which brings us to the question of boosters. I'm seeing questions, about that popping up all the time. So many different networks and stations are posting their pandemic experts who are fielding questions. And one of them I'm looking at today: is there a Moderna booster shot on the way?
I think absolutely there is for both Pfizer and Moderna. And probably the other vaccines, J&J and whomever. There's some suggestion based on what some of the other countries are doing that we may start with the higher risk people first and kind of move on from there. It looks like, especially with the Delta variant, that the immunity in the vaccinated people is dropping over a period of a couple of months. Still fairly effective, but it is dropping. So I think we're going to see that come out in the near future. A recommendation for booster vaccines. The question is going to be, which vaccine will you get for a booster? There's a lot of suggestion that maybe we should be giving a different vaccine as part of the booster, so that remains to be seen.
When you say a different vaccine, do you mean if you got the Pfizer first, it's more Moderna now, or are these companies tweaking the formula based on some of the other variants that we've been seeing?
Both.
Okay.
They're tweaking their boosters based on the variants, and they're doing studies about crossing over to a different company's vaccine to see if that would give better immunity.
Dr. Norm, one of the other things that we were hearing about along the lines of vaccine hesitancy is the lacking of FDA approval. Why is that taking as long as it's taking? And, well, I guess I'm going to leave it at that. Why is FDA approval taking this long?
I don't have a good answer to that. The FDA would argue that in previous situations, it takes years to get full FDA approval for vaccines, and we're only looking at 2 years, so this is still on a fast track. But for full approval, I think they're still looking at the end of the year or beginning of next year. It's unfortunate, but I guess if you look in the big picture, again, based on a time frame of several years, we're still on a fast track.
All right. That's a good, yeah, because that's one of the things I keep reading over and over again on the vaccine hesitancy. Places where you see people laying their opinions out is the biggest one is, what's the deal with the FDA? And I think you clarified it very nicely because not many things get speeded through FDA approvals process.
Absolutely. And again, it usually takes years, sometimes upwards of 8 to 10 years to get full approval for vaccines. And we're still looking at a time frame, again, of less than 2 years.
All right. Well, we were hoping, this would be the morning we tell you, hey, we're all out of the woods. It's all done. We're packing things in. Dr. Norm's going back to Tucson to tend to a rock garden. But no.
A couple more weeks.
Yeah. Looks like a couple of more weeks.
You're probably stuck with me for a while, unfortunately.
And we are happy to have that. Dr. Norm, as always, thanks for your time. We'll look forward to talking to you again next week.
All right.
Appreciate it.
Talk to you guys later.
Results on Major League Baseball season. We're still getting games suspended. We're still having players test positive. And we still have to look at a playoff situation and setup that's going to be safe and responsible for everybody in each state that they go to. So, this is the logistics there aren't even done. And I think we've got a little ways to go before we can really dig into it.
I think even the casual fan, though, is picking up on the vibe from broadcasters, though, that next season could be at best dicey.
Yeah, we'll play baseball. I think that's for sure. If we get started late, it'll feel just like we did last season, hopefully, and then a joyous return to baseball. But I don't think given the present economy that anybody wants to wait out an entire season. I mean, you saw what that did to everybody as they waited and stamped their hand on the table to try and get things going last season. I mean, it's an entertainment source, but it's a livelihood for a lot of people.
Well, Connor, the Cubs suffered biblical losses. I don't know if you heard that.
I had heard the phrase.
I'm sure you have. Well, Connor, thanks a lot for joining us. You sound great on the air. And,
yeah, you do.
And you're doing a great job play-by-playing. And hopefully you can swing by and talk to us again. Maybe get that playoff preview we're going to have in a couple months here, and a big World Series run. It's going to be fun.
I think we can book that right now. You guys want to put that in the books here on the air? I think we'll be okay on that one. Appreciate it, fellas.
I love on-air meetings. They're my favorite.
Yeah, Connor, you're doing an outstanding job. Sox fans, you get a treat every pre- and post-game. You're getting a treat with play-by-play as well. Connor does spectacular work. We really appreciate your time, man. Have a great rest of your day.
Thanks, fellas. Take care.